this video, I want to explore female saddle issues, why we might get pain, chafing and swelling in and around the vagina area, and how we can solve it.
When you're cycling, there is friction, there's heat, there's moisture, there's sweat. That again can just traumatize the area, but also change the balance of the bacteria. I see ladies who are really embarrassed to come and see me, and I'm like, please don't be. I've seen it all. To do this. I have, I've seen it all. There is no evidence to say that cycling causes any sexual dysfunction. You should still have enjoyment in sex, still be able to orgasm, hopefully.
Cycling should not be uncomfortable. You shouldn't be in pain or have a sore or numb vagina when you ride your bike. Yet I have had so many conversations with women that have been put off cycling because they can't get comfortable on the saddle, and other women who just carry on in pain because they don't realise cycling can be comfortable.
There is a lot to discuss on this topic, so I wanted to bring in an expert today. I'm off to see occasional cyclist and consultant gynaecologist Jess Preshaw at the Southmead Hospital in Bristol. As cyclists, there is a lot of pressure on our vagina when we ride. It is one of our main contact points. But why might female cyclists be more at risk of getting issues down there?
Well, I think let's just think about the anatomy first of all. So really the problematic area, or potentially problematic area, is the vulva. So that is the external genitalia around the vagina that you can see. So it's the inner and the outer labia, or lips as they're sometimes called, and also the clitoris. And the other bit that's in contact with the saddle is the perineum, which is this bit here, which is that soft tissue area between the back of the vagina and the anus, or your bottom. And it's this vulval and perineal area that's in contact with the saddle. And as you've said, this is where your saddle is, so you've got direct pressure from the saddle on that area, and it's going to put pressure on the blood supply to the area, to the drainage of lymph that might mean you get some swelling. And you also have your pudendal nerve that just comes in from the side and innervates the area, and pressure on that nerve can cause damage to that nerve, leading to pain or numbness. And the vulval skin is really delicate and very sensitive, so it's prone to trauma. And when you're cycling, there is friction, there's heat, there's moisture, there's sweat, and that again can just traumatize the area, but also change the balance of the bacteria within the vulval skin and within the vagina, and potentially increase your risk of developing an infection.
So is it fair to say that you could have the perfect saddle, the perfect cycling shorts, best bike fit, but if you're staying in your cycling shorts too long, you're a little bit sweaty, you could still get problems down there?
Absolutely.
From chatting to a lot of my friend female cyclists, they get a lot of, I guess, problems with the skin of the vagina, irritation, lumps. Is that quite common?
Yes, and that's something that I see within ladies I'm seeing in clinic. So you can get irritation in the skin, but that can lead to discomfort, that can lead to soreness, that can lead to pain, and generally experiencing pain in that area, but also pain on urination or pain with sex. And it might also mean you get ulceration within the skin or some fissures, so that's where the skin splits, and that's really painful. And if somebody already has a pre-existing vulval skin condition, then placing cycling on top of that might make it worse. And the other group of women that sometimes have issues is ladies entering the menopause, because you've got a lack of estrogen within the vulval tissues, and it means the skin is even more delicate, more prone to trauma, and that means more problems. So there are things that we can do about it. I think it's really interesting that everyone has a skincare regime for their face, and the skin in your vulva is as delicate as the skin on your face. And so I really advise adopting a good skincare regime for that area as well.
I've never thought about it like that, but it's very true.
Well, people will use water, or they'll use fancy bubble baths or perfumes, or sort of perfumed bubble baths or fancy soaps. And actually that can be exceptionally irritant. And some people are really worried about their personal hygiene and use some of these feminine wipes. Again, they're really irritant for the vulval skin. So I would say ditch all of those and adopt an emollient instead. So an emollient is a medical moisturizer. You can buy, there are many different types. You can buy them over the counter, but you can also get it on prescription from your doctor. And they come in different consistencies. So some of them are more oily, and so that would be an ointment. Some have more water within it, and so that might be a cream, for example. But it's to use that as a soap substitute, and you can also just apply it liberally to the skin so that it stays throughout the day, so that it stays moisturized. It's really soothing, and it's also protecting, so it creates a barrier to the skin. So you could place that on before you ride to help protect the vulval skin.
So trying to keep it as moisturised as possible, is that like the best scenario for it?
Absolutely. And particularly with the vulval skin, going for more of an ointment-based emollient would be better because it traps more moisture within the skin. It's going to keep it supple and less at risk of trauma. And if people do develop trauma, so an ulcer or any fissures, then something that can be really handy is a cream called Ovastin. Essentially, this is an estrogen-based cream, and it's something that is on prescription only. You can't just buy this over the counter. Some people worry that this is HRT because it is so hormone replacement therapy, because it's got estrogen within it. But this is locally acting estrogen. So for the majority of people, it is super safe, and you can just get a mirror, look at the areas that are sore, and if there are sore areas and open areas, then rubbing this on that area is going to help it heal much quicker and soothe it for you. So I would really recommend getting this particular cream.
So say if, a rider did have, an ulcer or a lump down there, should they carry on riding on it, or should it be rest until it goes? Or should it go overnight?
I think it depends on the severity of the problem. If it's really sore and you've got a really open fissure, I probably would take a little break from cycling just to let it heal. But, there are other things that you can do to prevent this happening. So wearing well-fitted garments, padded cycling shorts, actually not using underwear. And if you are going to use underwear, using cotton underwear and, sensible pants. It's not sexy, and it's, but unfortunately, yeah, it's boring but true.
It's good for down there.
Sensible knickers. And, if the area is sore at night, for example, don't put any underwear on. Just sleep.
Let it go free.
Yeah, let it go free. Just let it breathe and just let it heal. Because that's good. Yeah, that will help the skin.
And then, so pain urinating is something that cyclists can get as well. I guess what causes that in the first place? Is it just too much pressure in the wrong place?
It can be for a variety of reasons. So if the skin is sore, if you've got open sort of ulcerated patches and then you're urinating and that urine then goes onto those sore areas, it's going to really sting and burn. So you want your urine to be as dilute as possible, so staying well hydrated, and you can place your ointment emollient on those areas to act as a barrier, and place it, rub it on throughout the day so that you've got a constant barrier on the sore skin. That would be really helpful.
And I guess, are we more at risk of getting infections down there?
Potentially, yes. So, we were mentioning about pain when you urinate. So if you are dehydrated, say from a long ride, then that can increase your risk of a urinary tract infection. So it's really important to stay well hydrated, so drinking plenty throughout the ride. But also, I mentioned earlier on about that change in the balance in the bacteria of the vulval skin and in the vagina. And that can lead to thrush. It can lead to something called bacterial vaginosis. So this is where you get a change in the balance in that bacteria, and you get an overgrowth of some bacteria, and it leads to this smelling discharge, and you get quite a lot of discharge, and that can be quite unpleasant. So there are treatments. So if you've got thrush, you might go and get an antifungal pessary or cream. That can be an over-the-counter thing. If you had bacterial vaginosis, you could get some antibiotics from your GP. But there are also things that you can do to avoid this happening in the first place. So you don't want to linger in your clothes after a ride. You want to, wash after your ride, and also wash your clothing on a high heat afterwards, so that if there is any bacteria or fungus within the padding of your well-fitted, padded cycling shorts, that actually it's nuked, and the next time you put it on, it's clean and fresh and reduces your chances of an infection in that area.
And with a bit of treatment, they should go. They shouldn't stay for a prolonged period of time.
Absolutely. These are very treatable, and actually some minor modifications are going to stop it coming back.
So it shouldn't be a worry if you do get anything like this?
No, I wouldn't worry about it. Yes, it is worrisome when you get it, and it's annoying, and you might be a bit embarrassed, especially like ladies come to me and say they're a bit embarrassed maybe by the smell or the discharge that they have. Don't be. Actually, go and see someone about it if you're worried about it. Talk about it, because this is treatable. And if you've recognised that, maybe your ride has triggered that, then make a few changes, as we talked about, so that it doesn't happen again for you. So no, do not be put off cycling because of a risk of infection.
I guess on the topic of infection, is there anything else, that we can do to take care of down there? Pubic hair, I know there has been quite a bit of chat about what we should do with our pubic hair.
Ideally, you need to embrace your pubic hair. It acts as a wick to take sweat away from the skin. It provides a cushion.
Extra layer.
Absolutely, but extra padding, comfort. But the other problem is that many ways to remove your pubic hair, so waxing or shaving, cause damage to the skin and create tiny nicks in the skin. And that can lead to soreness, and it can also be an entry point for bacteria and infection. So if you are having to do some pubic hair related maintenance, then I would suggest trimming is probably your optimum method of removing hair in that area, rather than shaving or waxing.
A lot of people use shammy creams and creams like that to help with friction. Would you recommend using things like that?
Good question. I wouldn't recommend it. A lot of them are perfumed and irritant, so you need to use something that's more gentle, so your emollient.
Okay, and I guess moving on to something a little bit different, swelling of the vagina, because I think that is something that can be quite common in cycling, especially when, I guess, professional cyclists spending hours and hours on the bike. Swelling can, I guess, be normal sometimes down there.
Swelling's a big issue. So you've got all that pressure, and that can lead to swelling. It can be on both sides, actually, of the vulva, so the labia becoming swollen, or it can just be one side. And it's more common in people who have an asymmetric gait, or your labia are sisters, they're not twins. So everyone has some degree of asymmetry, but if there is really marked asymmetry, that can also lead to problems with swelling. And there are two little glands at the base of the vagina at 5 and 7 o'clock, if you're looking on at the vagina, called the Bartholin's glands. And they secrete mucus to help keep the vagina moist. But if they are irritated, constantly irritated, it might lead to a blockage in those glands, and that means that you can get a swelling in that area. So it's almost like a little marble or a golf ball developing in that area. And if that then becomes infected, it could cause an abscess. So it might be a cyst initially and then form an abscess. So, and I suppose actually the other reason people experience swelling in that area is boils. So again, there are things that you can do to mitigate for this. Get a proper bike fit.
Yeah.
It's a really, really good thing to do. Make sure you've got a comfortable saddle. So wider saddles tend to take some of the pressure off. And also raising your handlebars up in relation to the saddle is also helpful, because what that does, if you're really sort of stooped over, you get a lot more pressure on the vulva and the perineum. If you're slightly more upright, that pressure is transferred back onto your seat bones. So that's the ischial tuberosities of the pelvis, which are the ones you feel right at the base of your bottom. But actually taking the weight back onto those bones will help reduce any swelling related problems in the vulva.
But I say if someone was getting swelling down there, is it again stop riding your bike until it goes down? What if it doesn't go down? What should you do?
Again, I think it depends on how bad the swelling is. Having a short break to let it go down is okay. And actually, even when you're riding, just getting up out the saddle, just to give your perineum and the vulva a break from pressure of the saddle. If it's really swollen, if you're finding it difficult to, sit down on it at all, I think go and see someone about it. Don't ignore that. Also, if there are pressure-related problems and swelling problems, that can also mean that there's sort of micro damage to the nerves in that area. Probably not lasting damage. If you completely ignored it and it was constantly swollen and sore, that might put you at risk of lasting damage, but in the short term, it's not going to cause damage. But it might cause numbness in that area. We mentioned pain, so it can be uncomfortable. Some people, I think, worry about if that area is numb and a bit swollen, what's that going to mean for my sex life? Well, actually, I can be reassuring. There is no evidence to say that cycling causes any sexual dysfunction. So, you should still have enjoyment in sex, still be able to orgasm, hopefully. So it shouldn't affect your ability to reach an orgasm.
And no matter what, the severity of the problem is down there, it's really good to say that you don't need to be embarrassed about going to the doctor about something like this. And
definitely
I feel
not.
like a lot of people might be like, oh, well, it's not that bad, I don't need to go. But it's definitely better to go and be safe and not sorry and let it get worse.
Definitely. So many people are embarrassed about this, and it's a taboo subject, and it shouldn't be. This is a really normal thing, and I know I'm a gynaecologist. I talk about this all day, every day, so it's easy for me to talk about it. But I see ladies who are really embarrassed to come and see me, and I'm like, please don't be. I've chosen to do this. I've seen it all. I talk about these issues all the time. This is nothing to be embarrassed about. And actually, don't suffer with this. There are loads of things that you can do and people that will help you. And, you should have confidence in that area. I mean, there are some symptoms, I suppose, that people should, watch out for. So, if you have persistent itching, soreness, bleeding, if you develop a swelling in that area, if you develop an ulcer in that area, then I would say, go and see your GP about it. And also take a mirror, look at your vulva, know what is normal for you.
Get to know it.
So if you do develop any skin changes, like either a change in the color of the skin or the texture in the skin, you'll recognize that, and then you can see someone if you need to. And if you have got those symptoms, also don't just assume it's all a cycling related thing. Some of those symptoms might be a marker of something else, and sometimes something more sinister. So if you are worried about it, go and see your doctor about it, because they can check it out for you, provide you with some reassurance, and if it does need any other treatment or tests, then they can get that put in place for you.
Well, it's been really insightful to chat to Jess today, because I've learned a lot, and I hope everybody watching this has learned a lot as well. And if you think this video would be useful for someone, please send it to them, or if you have a cycling group, send it their way so they can watch it and hopefully learn something too. But as always, if you enjoyed this video, please give it a big thumbs up and let us know in the comments what you thought.